for the providers who were who would be out of their training, out of their residencies, and seeing patients, making sure that they were aware of the current literature and of also the historical pieces of the
100%.
medical system.
Yep.
Knowing that, to be able to understand that, okay, well, it's not that my quote unquote diverse patients tend to have a harder time adhering to their treatment plan, right? It's a why is that? Well, there's actually some pretty intense reasons, historical reasons why some communities just have an inherent distrust of the medical system. You think back to we talked about a brief didactic on the Tuskegee syphilis study, and it was I wish I had taken a poll of how many providers had heard of it, but it was shocking to me how many providers, medical providers, physicians or not, have not heard of Tuskegee, which for our listeners who don't know, was a study started. It was a 40-year study between the 30s and the 70s, where 400 Black men were identified who had active syphilis, and they were told that they were going to be given treatment, but their diagnosis of syphilis was never disclosed to them, and so they were followed all these years and had some devastating ramifications, of course, because they let the disease go untreated. It was spread to partners and family members. Resulted in deaths, and now we look back at that and we're like, how was that ever allowed to be okay? How was that ever a thing in healthcare and physicians, deceiving people like this? But then that's not an isolated event. We see unfortunately in the United States, forced sterilizations have been a huge history marker of becoming out of the false research in eugenics and I have a family member who was personally affected by a forced sterilization, or unwittingly part of it, because the documents that she was told to sign were not translated into Spanish, so she didn't realize what she was agreeing to, and when they came to, they had an involuntary hysterectomy. So these things have happened, and they're much more recent than I think than we realize. And so many providers don't if they know it, it's hard for them to connect the dots and that those are still having lasting impacts on our patients and our populations today. So and I think that's where again that we kind of come in with so this happened. We're learning more and more about not only individual trauma but generational trauma and how not only psychologically but physiologically has lasting impacts, right? And so I think that is another area where it's important for us to educate and to bring alongside, to walk alongside, and to make sure that we are as aware as possible of what our patient populations need.